Good morning. So I'd like to share my PowerPoint on the simulation observation that I had. Mine was actually at Roberts Wesleyan College. The simulation was run by Laura Coles, who was the presenter. She is actually a clinical instructor at Roberts Wesleyan College, and she's now actually the clinical director of the Sim Lab. So a description of the simulation scenario and debriefing. So the patient experienced stroke symptoms while admitted to ED-OBS. So the patient actually came in complaining of dizziness when she was seen in the emergency room and then was admitted to ED-OBS. The sim was broken into 4 components. So each of the components built on the next one. So it started with a nurse report that the instructor gave the nursing student. The nursing student went in to assess the patient. They had a patient deterioration and then called it, and then the next nursing student came in. There was only actually 2 nursing students that were in at the time, so they kind of both worked together. A debriefing was done halfway through to see if any of the students had any questions, and then a final debriefing was done at the end of the sim. They were given 7 objectives that were to be completed, and this was given to them prior to the start of the simulation, so they were aware of what they needed to do. And then students were given the opportunity to express any final thoughts on how they thought the sim went, along with any questions that they had. Um, Students were given a assignment to complete upon finishing the sim, so they were given time to discuss any questions they had at that time as well. Observation of the effectiveness of sim. I thought it was an effective experience for the students. Any errors that the students had were actually held until the end of the sim, so they didn't call a timeout during the sim to address those. It was either at the halfway point of the sim or at the end that they discussed those. They were provided with objectives, so they understood what was expected of them. So the objectives were actually as part of their pre-assignment, so they knew what those 7 objectives were. That 7 objectives were reviewed in the pre-briefing that they had before the sim started as well. They were given a pre-assignment to complete prior to going into the sim. So this, they were given a list of medications that they needed to look up that the patient was on or patient would be administered, along with skills that they, as senior nursing students, would have already been familiar with, such as suctioning and Foley catheter placement, that kind of thing. So therefore, there was preparation required for the student. It wasn't just show up and do your sim. You had to do preparation. The instructors did ask questions that pertain to the information that was in their pre-assignment to make sure that they did complete it. And then they were given an assignment to complete at the conclusion of the sim. So at the conclusion, they were instructed to document patient assessment. So they were actually given a form that was already available for them to just check the boxes for the patient assessment. And then they had to write a patient note that was on the back sheet of that paper that they were given. The patient note needed to include interventions that were performed and then the evaluation of the patient's care with those interventions. And then lastly, they had a graded assignment, which was a concept map that they had to do. And students were given a grading rubric for that. There was time at the end of the sim. The sim was scheduled from 1 to 5. It went to 4. So they were given time at the end to do the concept map, and they were given the opportunity to do that as a group with the other student, or they could do it on their own, whichever they preferred. Benefits of using SIM. It provides nursing students with a non-threatening environment. If an error is made in a SIM environment, it's not going to cause any catastrophic injury or harm to a patient because the patient is obviously a mannequin. The sim environment was a realistic environment in regards to the equipment that was provided. There was also a medication cart there for them to give medications. The mannequin was actually able to answer questions. So one of the instructors was actually the one that was speaking as the mannequin. So it was more realistic than having just the mannequin there hooked up to the mic. You could see if vital signs changed, but this mannequin was actually able to communicate. Students were able to practice their communication skills, and this was on multiple levels. So students were able to practice how they communicate with the patient. As I said, the patient was able to provide answers and responses. They were also able to practice how to communicate with family members. One of the instructors did ask, portray a family member during the scenario, which, as we know, is not always easy to interact with family members. And lastly, they were able to communicate with an interdisciplinary team, such as something went wrong with their patient. They were able to call in a provider to talk to them about it. Pharmacy was available. so they could work on how to communicate with those different disciplines. They were able to build on their clinical skills. So these are senior nursing students, so they already know how to insert a Foley catheter, do suctioning, that kind of thing, but they were able to practice it. So a couple of the skills that I observed that they did, like I said, was suctioning, inserting a Foley catheter, medication administration, programming the IV pump, and patient assessments, including a neuro assessment because the patient was experiencing stroke symptoms, so they had to do a neuro assessment every 15 minutes. And it provides a positive, well-rounded experience for students. You don't always have the best clinical experiences, unfortunately, such as how to communicate with a family member or how to communicate with the provider. Sometimes it's just not a good experience for students. So having to make a phone call to a provider, it can be a very daunting task, especially as a nursing student. You know, you're not quite sure of yourself. And then you have to call a provider and get all these orders and that kind of thing. So it can be very terrifying. So it's a good the sim provided them a chance to go through the SBAR and how to do that and what information you need to give the provider when you call. You want it to be a very concise message. Um, so they were able to do that. And I thought, you know, it was a non-threatening, like I said, non-threatening environment that just provided a really good experience for the students.